Hello, everyone. We're going to go ahead and get started in just a minute. For those of you joining online, we're going to go ahead and get started once we get a few more folks in the room. So welcome, everyone. Thank you for joining us at this event on advocacy to achieve the SDGs for children. My name is Lucy Sullivan. I lead the Global Health Advocacy Incubator, the Global Health Advocacy Incubator, or GHAI, as we often refer to it as. We use the power of advocacy to reduce preventable deaths and to improve health at scale by changing policies and strengthening health systems. So I'd like to begin by, first of all, thanking all of you for being here and thanking UNICEF for co-hosting this event with us. UN agencies are a bit like our children. You can't choose a favorite, but if I were to choose a favorite UN partner, it would have to be UNICEF. That's why I'm really delighted to announce that the Global Health Advocacy Incubator has a new partnership with UNICEF, formalized just a few days ago here in New York. Together with UNICEF, GHAI will advocate for policies and support governments to prioritize civil registration, ensuring that no child is left behind. And this is, of course, critical to achieving the SDGs and achieving a future where every child can thrive. And this collaboration is really driven by a shared vision to ensure every child has access to civil registration, particularly birth registration, starting with, of course, children in low and middle income countries. Birth registration is the foundation for identity, the foundation in many respects for human rights, and it is really key to unlocking the rights of children. It helps to ensure that children have access to education, protects them from underage marriages, and guarantees their legal rights. It also enables them to access primary health care, safeguarding their well-being right from the start. So it's pretty foundational. And today we're going to talk a bit more about that, but many other health issues that impact children. And we're joined by an impressive group of experts, advocates, activists representing donors, civil society, and of course, multilateral organizations. But we have a lot of experts in the room. So just, we want to hear from you all and really have this be a conversation. So we have allotted a good deal of time for Q&A after our panel. Why are we here? I mean, we convened this discussion because success on the SDGs, as we all have heard in other events, I'm sure, is being threatened by any number of factors, from climate change to armed conflict to economic inequalities and pandemics. Vulnerable groups, especially children, are the most affected. And sadly, progress on child survival has slowed. Tens of millions of children are missing out on vaccines and essential medicines, and children continue to face an epidemic of malnutrition. And this is unacceptable, right? I mean, not only does disease and malnutrition rob children of their futures, it also robs us, the world, of the kinds of problem solvers and climate scientists and health professionals and decision makers we're going to need to address the issues that threaten the survival of our planet. So make no mistake, delivering on the SDG agenda for children will require advocacy. I mean, this is a battle we need to take to policymakers and politicians, really to translate the global agenda that we all are here and know about to country and local action. And that's really where we hope we can move the needle. Effective advocacy and policies depend on knowing what we need to do, what we need to fix, and how to fix it. And so that means reliable data, reliable, relevant country level data to be able to inform policies and advocacy strategies. So what today's speakers will tell us is that successful advocacy models do exist to achieve progress, and that they can be supported and replicated. So a crucial first step, of course, as I noted before, is that every child is counted and included through robust and effective health data systems. We're going to hear a lot more about that from our two keynote speakers. For those of you joining online, this event is being simultaneously interpreted in French and Spanish. So please press the button at the bottom of your screen to access those translations. We invite all of you in the room online to join the conversation on social by using the hashtags Global Health Advocacy and UNGA79. So now it's my distinct pleasure to introduce Bhaskar Mishra. Bhaskar is a civil registration, vital statistics, and legal identity specialist at UNICEF. So Bhaskar, over to you.
Can you hear me? Thank you, Lucy. Thank you, the GHAI team, for this opportunity. My name is Bhaskar Mishra, and I'm the Global Technical Lead on Civil Registration, Legal Identity, and Statelessness with UNICEF headquarters. It is both a privilege and a proud moment for UNICEF to engage in this crucial conversation on the role of advocacy in achieving the SDGs for children. Over the past few days, many events have highlighted various accelerators of SDGs, and rightly so, as we are just 3 months away from the final 6 years of the decade of action. However, this event stands out as one of the few that focuses specifically on the indispensable role of advocacy from the global stage to local communities. We at UNICEF are proud to partner in this effort. Any conversation around the SDGs cannot be complete without considering the SDGs for children. Children constitute roughly 1/3 of the global population. Their share is as high as 49% in sub-Saharan Africa and 46% in least developed countries. So any deliberation on the progress of SDGs will not be meaningful unless we first delve into what is happening to this particular cohort, which is tomorrow's future. Without going into actual goals, targets, and indicators, I want to share a few realities that babies born today face. Out of 100 children born today globally, 22 will continue to be delivered at home. 14 will still not be administered the life-saving DTP1 vaccine. 28 will not have their births registered, and 3 will not reach their first birthday. The realities are starker for babies born in sub-Saharan Africa and least developed countries and those belonging to marginalized and vulnerable groups. The 2023 UNICEF report on progress on children's well-being underscores the urgent need for swift action to realize the SDGs for children. 2 in 3 child-related SDG targets either require acceleration or are not being monitored. A widespread lack of data availability and quality data compromises our ability to track children's progress and identify those who are left behind. So what is the solution? How do we reach the critical last mile? For this, we must count every birth and every death and everything that comes in between. Counting alone is not sufficient. These events need to be counted at the right time and in the right manner. To leave no one behind, we need to know who, where, and how these children are. This brings in the criticality of well-functioning CRBS systems that can provide countries with crucial details for any population segment at any level of disaggregation and almost in real time, which is not possible from any other data source. Let me ask you, what is one critical secret of countries that are on track to achieve the SDGs for children? Each of these countries has successfully built and integrated its health and CRBS systems. CRBS systems are the backbone of accurate population data, providing correct numerators and denominators, and are essential for tracking progress on 12 of the 17 SDGs and over 60 indicators. However, to replicate this success globally, particularly in low and middle income countries, there is an urgent need to prioritize establishment of robust CRBS systems that are universal, inclusive, gender responsive, equity based, and interoperable with health, education, social protection, and national ID systems. While we already have good models from the global south, scaling this impact requires more than technical solutions. It demands strategic country level advocacy, and that's why we are here. Advocacy at the country level is critical to turning global commitments into tangible action and measurable impact for children. By engaging the right stakeholders, governments, civil society, and development partners, we can ensure the health and civil registration systems are prioritized, integrated into national strategies, and receive the necessary investment and political will to drive lasting change. Two critical areas that demand immediate attention in our advocacy efforts are, first, the cost of inaction, the economic consequences of having or not having well-functioning health and CRBS system, because this is a message that will go straight to the top policymakers. Second, there is an urgent need to establish a seamless health civil registration national ID pathway as the foundational layer of the digital public infrastructure. You know, the digital public infrastructure conversation is going around. This approach promotes the efficient collection of data once, allowing it to be used multiple times. So collect once, use multiple times, and facilitates the movement of information rather than people, enhancing overall efficiency and inclusivity. In closing, let me reaffirm UNICEF's unwavering commitment to ensuring no child is left behind. We remain dedicated to collaborating with partners and stakeholders to continue driving this crucial work forward. Thank you very much.
Thank you, Bhaskar. We really appreciate your dedication and passion for this work. Speaking of passion for this work, we're now going to hear from Betsy Fuller. She is with Bloomberg Philanthropies. Since 2009, Betsy has worked on the public health team at Bloomberg Philanthropies. Her work promotes collaboration between partners, whether they're private or bilateral donors or direct partnerships with agencies and national governments and civil society organizations. She is a true believer on the power of advocacy, and we greatly appreciate that. So Betsy, over to you.
Thank you, Lucy, and everyone. Welcome. I know it's such an exciting week and you all have many events to attend, so thank you for being here. And thank you to everyone joining online. I'm so pleased to be here alongside our colleagues from UNICEF and GHAI and many of our partners representing Bloomberg Philanthropies supported programs. As Lucy said, I've had the privilege of working on the public health team at Bloomberg Philanthropies for the past 15 years, and where we're dedicated across the philanthropy to ensure better, longer lives for the greatest number of people around the world. While our programs span public health, environment, government innovation, the arts, and others, our public health programs are also broad and wide and span issues such as tobacco control, road safety, drowning prevention, food policy, and data as well. So, however diverse those content areas are, we definitely share a similar approach across all of our public health programs. We address these unmet needs, often needs that are not, at the forefront of people's minds, especially on the philanthropy side, such as injury prevention and food policy. And we also engage with strong partners. This is the core, really, to everything that we do, are the people behind the work. And you'll hear from some of them today. We partner not only with civil society, as the advocacy piece is critical in promoting public health policy, but also with government agencies across many sectors. As Bhaskar mentioned, the complexity of civil registration and vital statistics, which we have a significant investment in through our Data for Health initiative, has many partners in government that are responsible for different pieces of those critical data and getting those data to the important agencies and policymakers that need to make decisions to protect health. Those lives that we are protecting through public health policy are, of course, should always be reaching the hardest to reach. And often those are children around the world. As Bhaskar mentioned, more than a quarter of births are not recorded or registered in many countries around the world. And over half of all deaths are not recorded or registered around the world. So these gaps are really critical to understanding and addressing a lot of the causes of early death in many countries. And it is relevant to all of the other work we do. The Data for Health initiative helps to partner with governments directly to build capacity around building entire systems and to not only collect the registration and cause of death data on births and deaths, but also to utilize and push those data through to different agencies, to ministries of health, to be analyzed and synthesized into policy briefs and other very important technical solutions and policy solutions to make impact on the ground. So it's absolutely critical through these partnerships. They sound, very technical and wonky sometimes, but then we have the important aspect of advocacy to really raise these issues, raise the importance of these issues to the general public, to users at every end of the spectrum, whether it's someone who is registering their child, their birth of their child so they can access education or immunization services, to registering a death of a loved one so that their cause of death is properly recorded to go towards prevention of early cause of death, as well as for ID and other civil service functions such as inheritance and land ownership passage. There are many pieces that are involved, and that's why advocacy is so critical at each level, whether it be at the birth or at the death. When people aren't counted, they are not taken care of. And this is why we're here to talk about a lot of the solutions that our partners are implementing around the world. And we're very proud to always partner with civil society as well as government, because sustainability is through policy, and civil society will keep those governments accountable to those policies. So we rely on data, countries rely on data, and we really ensure that we would love to ensure that sustainable policy change is possible to continue to protect and save lives around the world. I'm really looking forward to hearing from the panelists today. Many I've known for a long, long time, and to hear about the great work they're doing to advance children's health and well-being, and including the work to make sure that every child is counted and no one is left behind. Thank you so much.
Thank you, Betsy. So now it's time to turn to our panel, and we're fortunate to have a set of experts representing civil society organizations and advocacy movements that are advancing policies in their countries to improve health at scale. One of our panelists, unfortunately, was unable to make it today. We found out late yesterday that Cecilia Donosunu's mother passed away, and she's not going to be here with us. She is the executive director of Hope for Future Generations in Ghana, which is GHAI's lead immunization partner in Ghana. With support from Gavi, the Vaccine Alliance, we're working with Cecilia's organization to ensure that Ghana meets its commitments for immunization financing, and brings us a step closer to when every child is protected by vaccines. So we offer Cecilia and her family our sincere condolences. Turning to our panel and our panelists here today, I'm going to introduce them and ask them to please come up. First, we have Dr. Juan Pablo Bocarejo. He is with the El Grupo de Estudios en Sostenibilidad Urbana y Regional, excuse me, Sur, at the Universidad de los Andes. Dr. Bocarejo, or Juan Pablo, as he's asked me to call him, is a civil engineer with over 30 years experience in mobility and urban development, having authored over 100 papers on the topic, and he specializes in road safety, working as a researcher and public sector leader. He was with the government. He had been the Secretary of Mobility for Bogota, where he implemented the Vision Zero plan, reducing road fatalities by 15%. And he launched the Kids First program to promote safe mobility for children. Please, Juan Pablo, please come up. Thank you. Next, we have Dr. Nguyen Thi An, Country Director of Health Bridge Vietnam. Dr. An has served as Country Director for Health Bridge Vietnam since October 2018. She holds a medical degree from Hanoi Medical University and a Master's of Women's Health from University of Melbourne. She has 30 years of experience in child development, and she is a child rights expert. She has been a strong advocate for child rights policies and co-chairs Vietnam's Child Rights Working Group, where she led efforts to develop NGOs' complementary convention on the rights of the child to the UN committees. And our third panelist, please, yes, Dr. An, please come up. Thank you. Our third panelist is Rob Eckford. He is the director of GHAI's Data for Health initiative. And previous to that, he worked for the International Legal Consortium at the Campaign for Tobacco-Free Kids, where he administered the litigation fund, providing advice on how to counteract the tobacco industry, and particularly using instruments of trade and investment law. He has advised many CSOs and governments on implementing strong tobacco control laws. And prior to that, he worked as a public law solicitor for the government of the UK. Rob? Okay. So I'm going to go ahead and start with you, An. Can you tell us a little bit about your work in Vietnam and how you are approaching this issue?
Yes. Hi, everyone. And before talking about our work in Vietnam, I would like to share the story about myself and my children. And I was born in 1975, just few days before the war ended in Vietnam. And then, as you know, like other war, the country in the war is in very difficult time, where the natural resource is destroyed, and then we are living in very poor condition. And then I remember at that time, my family have only rice to eat, and even not enough rice to eat. Sometimes we have to mix with cassava to fill up my stomach. And then the meat is something is luxury. It's only used for the special occasion like New Year's holiday. So that's why it's not surprised that my children, now is it I myself and my husband, my generation is lower and shorter than my other generation, and uh, and now the children is have, thanks to the government, the life is better, and then the children have more nutritious food to eat. But they also facing another challenge, that overconsumption and eating too much of the unhealthy food. And like for our research recently showing that the obesity and overweight for children in Vietnam after 10 years, it more than double. So it's the pushing the children is very risky for that. And then the consumption for sugar drink is dramatic increase. Like for only for few years, the the number of the, how can I say, the average of the consumption for sugar drink for Vietnamese people on average is dramatically increased. And now we on average, we have like uh, a person like for 1 liter of sugar drink per week on average. And if we can see it's for children and youth who are the key person to consume that kind of drink, the number is much higher. And for dealing with that, what could we do for Vietnam? And for Vietnam, we identify our key stakeholder who interested on that topic. And so we engage with UN agencies such as WHO, UNICEF, and GHAI, and other local NGOs interested on that topic. And then we found that, yeah, it is a thing that we all have the same objective and the same goal, and then we engage with them. Secondly, we think that the youth play a very important role, and then we not much understand what youth think. And almost of the grow up people, like all the grow up people were children, but few of them remember when they were children, how the children think, how the children feel, why children takes a lot of sugar drink. And so that's why the initiative from UNICEF, the Fix My Food is coming, the campaign for that. And then it's really good for engaging the youth themselves to participate and to research, to make the surveys on how the children and youth perception about the SSB consumption. And then the youth themselves create set up the communication event for the children, for the other youth. And we also using the data and the research finding from the Fix My Food campaign to share with the policy maker at the national level and the policy maker. So that's why we engage them for more information. So the National Assembly and the policy maker understand the voice from youth. And the third thing is that we engage health and non-health sector who involved with us. Like, for example, we engage media with us. We provide the training course for the journalists, for the editor and the chief editors, so they understand the situation. And they know that the sugar drink is not good for health and particularly for children. We also engage with the School of Law, so they understand and they can support us from the legal perspective. And we also engage with the Child Rights Working Group. As Lucy introduced, that I'm the chair for the Child Rights Working Group. So we engage for the children from the children perspective, to protect the children. Because in Vietnam, knowing that in Vietnam, we save the best for children. So we put the children, there's a saying that children today, the world tomorrow in Vietnam. So we all thinking for children and protect children. And lastly, we advocate for a higher level that we try to push on the children issue in terms of the overweight and obesity in the UN Convention report from the NGO side. So after the report, the UN committee have a concluding observation, and one of the recommendations that for the government of Vietnam to take the measures to prevent the stunting for children as well as for overweight and obesity for children. So it's a few things that for Health Bridge we are working together with other agencies like for UNICEF and WHO and GHAI working on to fighting for overweight and obesity for children. Thank you.
Thank you, An. Use this microphone. Okay, next, Juan Pablo. So just for a little bit of context, road traffic injuries are the leading killer of children, or I should say of people ages 5 to 29. So there's a lot of children in that cohort. So this is, believe it or not, a big child health issue. And so we want to hear a bit about your work in Colombia, about how you've addressed issues of road safety.
Thank you, Lucy. First, very thankful with GHAI for this great invitation. I'm very honored to be here in this panel. So I'm going to tell you about our work in Colombia. So first, I'm going to tell you about the tough story that will put us in context on what we are doing. So this was summer of 2019. It was a wonderful year for Colombian cyclists because Egan Bernal, our champion, won the Tour de France for the first time. This is the biggest cycling race in the world, and we were very, very happy for that. We are very passionate about cycling in Colombia. A lot of people does it every day, every week. And Egan returned to his hometown to celebrate. And he was met by a massive crowd of devoted fans, of course. It was crazy celebration. And among the thousands was a young boy. He had about 10 years old, Julian Esteban. And he became very famous because the cameras, the media connected with him. He was so happy that his hero from the same city, Julian Esteban, was doing the same thing as Egan, so he was training to become a champion. And he was known by everyone in this moment. Unfortunately, Julian Esteban was training in a road close to his home, and he was hit by a truck. He had 11, so it was 1 year after, and he died. At that moment, we were working as a coalition of advocacy in Colombia. And we were struggling to change the law and to change the law to reduce speeds. Mainly, it was the safe systems law, but one of the main topics was reducing speed. And it was not going well. It's very unpopular. Government didn't want to be involved in the law. So that was going bad. So the issue wasn't very optimistic. The mother of Julian Esteban joined us, though she was in a terrible pain. She decided that she could do something useful. She joined us, and finally, we were able to pass the law. So the law is now in place in 2022, a year after. And that's like the kind of things we're doing in advocacy. And I think this is really going to save lives. So we are working on what we call the evidence. So the international evidence is speed is one of the main risks of fatality. As you mentioned, It's not a virus, it's not an illness. The first risk for young people, for children, is a crash in traffic. So we've been working in that, and we have prioritized safety for children. So it's like very strong, it's like a very strong message we can send. And of course, this will help the whole population. In the advocacy group, we've been working in different aspects. So the more critical, and it's happening all over Latin America, is motorcyclists. So children go by motorcycle to school. There are a lot of crashes. So it's really a big challenge. And the other one is, for example, child restraint that is not used and is not mandatory in our country. So there are a lot of things we can do to improve cars, safety, etc., and we are not doing that. So we are working mainly on those topics. But at the end, when you really need to address the need of safety for children, you need to change a lot of things. And that's what I'm showing in the pictures. It's two projects that we developed in Bogota, and they are under the label Kids First. And there was kids going to school by bike and kids walking safely. So there were these two projects that are going on almost for 10 years. We've had a lot of help from Bloomberg, which has been working with GHAI, with GRSP, in these kind of projects. And we have succeeded to really improve safety for the most vulnerable, the low-income kids that had a lot of trouble going to school. But this is not only like helping them in the way to school, giving them bikes, but changing the infrastructure, so changing the city. We need to change the city in order that the city, the public space, is transformed for the kids. We are used to build infrastructure, transport infrastructure for cars and to alleviate congestion. But this is not the most important. The most important is really saving children. So in these projects, we worked a lot on improving infrastructure, signals, etc. So we really think we have a huge challenge. I think advocacy is helping a lot, so changing laws, etc. But we are trying to go to the next steps in advocacy, and it's not only changing the law, but in many of our countries, we need to really make the law happen. So changing the law is not enough. And so we are working with the governments, with the local governments, so they really can change and put in place the Julian Esteban's law.
Thank you. It strikes me that you're working for children, but in some sense also with children. And I'll want to come back to that in the Q&A and when we have the discussion. So we've heard two country level examples of advocacy and the kind of impact it can have in moving policy, shaping social norms, reshaping systems. So now at the global level, let's hear from you, Rob, and the work that you do on the Data for Health initiative and partnering with governments and civil society to change laws and improve civil registration and vital statistics information.
Sure, thank you. I want to do a couple of things, and one is to initially reflect on what this panel is about, and that's the use of advocacy to achieve the SDGs for children. And what do we mean by advocacy? And fundamentally, that is about grassroots. It's about public voices, grassroots voices, pushing for political prioritization in order to achieve policy change, in order to achieve legal change, which then fundamentally shifts the public health outcomes that we're trying to achieve. So what does that mean in practice? It means from the perspective of our organization and funding from Bloomberg, funding from Gates, it's facilitating, enabling, providing resources and technical assistance to grassroots organizations within countries so that they can elevate those public voices, speak to politicians and decision makers so that those objectives can be achieved. Now, why do I put that framing there? I want to compare two sort of policy areas. The first being tobacco control, which I worked in for over a decade, with civil registration. Now, tobacco control, both of which are critical, absolutely critical to achieving SDGs for children. Both of these are recognized specifically within the SDGs, tobacco control under SDG 3 and targets under SDG 3, and civil registration under target 16.9. Being a lawyer, I'm going to be slightly wonky, and I can sort of list the exact references. I may do in a minute to sort of emphasize a point, but the comparison with tobacco control is we have a treaty, the Framework Convention on Tobacco Control, which specifically recognizes the importance of civil society in achieving the outcomes of that treaty. So Article 4.7 of the treaty specifically recognizes that. And you will be hard pushed to go into a country in the world and not find a civil society organization that is actively campaigning for tobacco control measures, for the implementation of the treaty, for reduction of smoking in public, bans on tobacco advertising, all the measures that we know work and can reduce tobacco consumption and reduce the power of the tobacco industry. Compare that to civil registration. You'd be hard pushed to go into a country and find a single civil society organization actively campaigning for civil registration. And yet the two things are in many ways equitably important. So I mentioned there the FCTC and the recognition, the international recognition of the importance of tobacco control. Civil registration is also recognized internationally. The Convention on Civil and Political Rights, 1966, Article 24, an obligation, international obligation to register every child immediately after birth. Equally, the Convention on the Rights of the Child, Article 7, obligation to register every child immediately after birth. Again, fast forward into the SDGs. SDG target 16.9 is that everybody should have a legal identity, including through registration of the birth by 2030. So at the international level, we know the importance of it. Other speakers have talked about how it's fundamental to accessing, providing individual identity, legal identity, accessing services. There was a really powerful New York Times article a few months back that did an investigative piece on the power of paperwork, which talked about a Colombian family had a birth in a very remote area. The child was feeling sick. They took it to the local city to get treatment, couldn't get treatment because the baby didn't have a birth certificate and it needed one in order to get treatment. So they had to go through the process of getting a birth certificate. That process was not simple. It took many trips to the registry office. It took weeks to achieve. By the time they had that birth certificate and went back to the hospital, it was unfortunately too late. So a really tragic story, but really indicative of how what we think of as just a simple administrative process can have really fundamental outcomes for individuals. But it's also about counting deaths as well is as important as counting births, because we can't know how, who's dying, what they're dying from, unless we're engaged in an effective civil registration system. So other SDGs, target 3.2, end preventable deaths of newborns and children under 5. We can't measure that without an effective civil registration system. Not only can't measure it, we also can't address the problems, because unless we know what children are dying, where they're dying, and what they're dying from, we can't implement policies to address that problem. So not only can we not measure that target, we can't achieve that target without an effective civil registration system. So whilst I've been slightly rambling and a lot of tangents, we're starting now to do what we do in tobacco control with civil registration. So through the Data for Health Initiative, through Bloomberg funding, we're actively starting to engage local civil society organizations at the grassroots levels to push for this political prioritization. The Philippines is a really exciting example of that, where we have a local civil society organization, PLCPD, that not only filed an omnibus bill with Parliament, but is now got this huge campaign to push for the passage of that bill. There are banners in the streets. There are posters on tuk-tuks. There's videos playing in airports, demonstrating the importance to individuals of the bill and what that bill will do, and pushing for the passage of that bill. And the civil society organization is actively reaching in, got a political champion in Congress, and we're really hopeful for success there. So that's a model, but we're equally we're moving ahead with civil society organizations in Kenya, in Uganda, in Zambia, in India, in Bangladesh. So hopefully we can put this and elevate the political prioritization. We've had a number of speakers talk about the number of deaths that aren't registered, the number of births that aren't registered in the world. If you go into a country and look at and speak to the Civil Registration Authority, you can quickly see in many of the countries where this is the problem, that that agency is fundamentally under-resourced. It doesn't matter what technical activities we're doing to try and improve the systems, unless that agency is resourced, the outcomes aren't going to be achieved. That's only going to happen if there's higher level political prioritization. That's only going to come through advocacy.
Thank you, Rob. I really appreciated a lot of the points you raised. And, in some sense, the opponent to some of these policies is apathy. In some sense, it's ignorance, and in some sense, it's industry. So, Anne, I want to talk a little bit about the work that you're doing on passing a sugar-sweetened beverage tax, and in Vietnam, and how you've mobilized civil society and other stakeholders to build support, the kind of support that Rob was just talking about, to get governments to prioritize this. And similarly with you, Juan Pablo.
Yes, thanks, Lucy, for interesting questions. Yes, at first, when talking about the SSB tax, it's still very new in Vietnam. And then is it still people not know about the harmful effects of the SSB tax? And then back to few years ago, when in Vietnam cultures, when we have somebody sick, and usually we bring sugar and condensed milk to give for that person. So they still think that sugar drink is something good for health. And to start with that, we provide information about the harmfulness of sugar drink. And then we bring the one of Coca-Cola, the Coke, and then asking that how many people get, how many teaspoons of sugar there. And then people were shocked about a lot of sugar they intake. And then we provide some information from the research from the National Survey about nutrition, about how children get the obesity and overweight and obesities, how about the NCDs problem that Vietnamese people are facing. And then they said, oh, okay, is this a problem now? And then we discuss together how we can solve that problem. And we found that it's really good to engage media with us. And the media, when they understand that, they can writing the article, talking on the television and on the radio program, and then they share that, and then they call a lot of attention from the public. Furthermore, we also doing our social media. We have a fan page. We set up a fan page for the sugar drink tax. And then we share not, at first, we're not specifically about the SSB tax. We just talk about the healthy lifestyle and healthy diet. And then people realize that, okay, is this a problem now? They have to change. And we found that also when we talking about that, we found that we need some legal to support for us. Like when we making an infographic about how much sugar in X kind of products for SSB, we draw some similar to say that is this a Coca-Cola or is this Fanta or kind of that. And we afraid at first, we afraid that it should make the company, we violate the law.
Yeah.
And then we consult with the lawyers to make sure that we are not violation of the law. And then the lawyers, they interested working on that. And we're looking for the lawyer who knowing about child rights.
Yes.
So that's why they said that, okay, it's this interesting topic. And he, as the lecturer at the School of Law under the Hanoi National Universities, so he engaged more other of colleagues from the school coming joining with us. So we step by step to join for that. And one important thing that we take from the perspective from to protecting the children. And then as I shared before, for our culture, children is the most important. We save the best for children. So from that perspective, is this safer and then better position to advocate for the SSB tax? So is that the way we?
Yeah, no, I really appreciate how you highlighted the importance of building the public awareness and the public support and then bringing in, different disciplines and stakeholders. And before I turn it open for questions from the audience, Juan Pablo, I would love to hear a little bit from you in terms of, what were some of the biggest challenges in your advocacy, particularly as it relates to the Julian Esteban law.
Well, I think I coincide with you. The first thing is creating awareness. So people are not aware of the risks of probably speeding. And so explaining to them that if you are hit at 60 kilometers per hour is like you fell from a building from the 6th floor, that starts giving you a different feeling about the risks. So we really need to work about creating awareness, providing interesting information, and change people's minds. And again, what we do is working a lot with media. So we do a lot of workshops explaining the journalists how this is affecting the everyday life of all of us, and how this is really the biggest risk our children have. So awareness is one thing. The second is money. We really need money to change things. I was telling before, to change in the infrastructure, etc. And one of the things we did with the Julian Esteban law is that there is a mandatory speed management plan that must be developed by every authority. So more than 300 authorities, local authorities in Colombia. So they need to do this speed management plan, and they need to put money and start thinking on speed management, because we never have enough money for road safety in cities, in towns, in Colombia. But many times this money is it's not invested in the more critical aspects. So this is the second thing, is financing. And the third thing is capacity building. So we really need that our authorities, our engineers, the people who is working every day on changing the streets, on building the streets, have a new mindset about what's important in infrastructure. And so we are working with the authorities. We have a network of authorities, and we are trying to like bring information and have discussion. And now some of the best authorities are teaching the lower ones. So I think these are the three aspects that I think are crucial to change things.
So with that, I'm going to go ahead and open it up for questions. I see one hand up here and, oh, hi, a couple hands over here. So we'll start with the gentleman in the front row. And what I'm going to do is I'm going to take, I think, 3 questions in a batch, and then we'll have the...
Hello, my name is Beto. I'm from Brazil. Actually, my question is related to engaging youth and adolescents in participatory models to strengthen the advocacy initiatives. Actually, we in Brazil, from the incidents of the G20, we are starting a collaboration called Children in G20 to provide more space to children and adolescents so they can be part of the transformation that we are advocating. And this is actually one key example of how can we change things and do differently and achieve different results. We are currently living another pandemic, which is the children and adolescents' mental health issues, which I think is a worldwide thing that we should be looking at in order to foster psychological resilience if we want to see the change that we're aiming to. Thank you.
That's a great question, and I do want the panelists to address the engagement of children and youth in these movements. I think over here, these 2 gentlemen, and then I see you in the back.
Yeah, thank you. It's a great panel, and thank you for the good insights from different countries, and also the Rob referring to the ICCPR, etc. My question is more or less the similar what the colleagues from Brazil has said, that in the advocacy for children, what is the children's participation? I mean, who leads this sort of entire discourse? I mean, Rob referred to ICCPR, etc., but I think it's also important to refer to the CRC. I mean, one of the 4 pillars of CRC is child participation. And for SDGs also, I think if you look at the group of stakeholders, there is a major group of women and, youth and children who are kind of leading the sort of global campaign on SDGs for children. So it would be really good to understand from your experiences.
Great. Simon?
Hi, my name is Simon Barquera. I'm the current president of the World Obesity Federation. I'm from Mexico. Congratulations for the great panel. And one question or thing I would like for you to comment is how the rules are changing right now with advocacy. Like we need the local advocacy, but also things like digital marketing are making local governments less able to regulate and to control that kind of forces. Like we need like a more international advocacy to be effective. I've seen like 3 or 4 years attempts to pass a resolution on digital marketing of breast milk substitutes without success. So how can we advance in this international advocacy? Thank you.
Question. I'm going to take your question, and then we're going to turn it back to the panel, and then we'll keep taking more questions. This lady right here.
Hi, my name is Ndidi Muneli. I'm the CEO and president of the One Campaign. And the One Campaign is a global advocacy organization that fights for healthy lives and economic growth in Africa. I'm really excited about the panel and the focus on local advocacy. Just building on the comments on the role for local and global, we have teams obviously in the G7 and in Africa fighting for African voices and African agency and shifting the narratives to ensure that we're demanding what Africa wants, not what the world thinks we need. And as I listened, I'm curious about mechanisms for bubbling up the local voices and amplifying them at the global level for some of the issues that we share. My background is in food and ag, and I've started a lot of companies there, and I love what you're doing at the local level, but some of these battles are for the global stage. How do you amplify those voices? And then how do we make sure that the local voices
are louder and that we have trusted messengers from our countries. What more can we do together as one and others to support each other in this fight? Thanks.
So two big themes, youth engaged in the advocacy, and then this, how do we local to global and the need for global conventions, global treaties. So I'll turn it over to Juan Pablo and An to perhaps try to tackle the first or both questions if you'd like.
Okay, about the children doing advocacy, I think we don't have much experience. We have very strong partner that is called Red Papas, and it's parents. So parents are really strong helping us in road safety advocacy. And we have youth for road safety too, that are more young people, but really not. I don't think we have been able to build like a space for the voice of the children. We really should learn about that, but I really think we don't have it in Colombia. The second, I'm very happy to hear about these questions, because I think we are trying to build this global advocacy. At least in Latin America, we had the chance to meet very important institutions that are working in advocacy. Mexico has been especially successful changing the law on road safety. So now there is a national law that has been changed. We've been working with Brazil, with Ecuador, and with Argentina. And this global alliance is very important to us because it gives us legitimacy, it gives us examples, it teaches us about the problems we could meet, and we support each other. So I really think that keep on working on this global view is also going to change and to provide arguments, awareness. So this is key for really improving things.
Comment? Yes, thank you. And interesting questions. Firstly, can I respond to the question about the child participation? And then, because Vietnam is one of the most earlier countries to ratify CRC. We are the second country in the world to ratify the CRC and the first country in Asia to ratify that. And in the CRC, the UN Convention of the Right of the Child, they're talking a lot about child participation. However, in Vietnam, because of our culture, because we are following the first cultures, that children just listen to the parents, listen to the adults, and then the child participation is still very challenging for us. However, we already working now with international NGOs and then UN, particularly for the UNICEF. We pushing for the children participation from at home, at school, and even at the national level. And during this week, the government of Vietnam conducting they call the National Children Assembly mock, like similar for the National Assembly. And then the children selecting the topic. And for this year, 2 topics are selected. The first one about child bullying. And the second one is interesting about new tobacco products. And because I have experience working on promoting for child rights and child participation, as well as I have knowledge about the new tobacco product. So that's why I was invited as a technical advisor on that topic. And then for that children to participate, and they identify how many children facing for that problem, and then they also put the question to push for the National Assembly member and leader to ask us question. And again, like what we are talking about that here is to, we are not only working for children, with children, but also by children. The children themselves, they should identify the topics that they are concerned. And then we provide them with the knowledge and skill to identify the problem and collecting data, and then they writing the finding and recommendation. And we help them to create the enabling environment where children can speak out at home, at school, or at higher level to raise their voices. But yeah, saying that, is it not like still we facing a lot of challenging for that because the parent, the school teacher, or the leaders, they not listen much to children. But nowadays, after a lot of awareness raising and capacity building, they recently, they're open-minded for that. And for the second question, and knowing that the time is not much, for local and international advocacy, we found that both are important and complement each other. Like for tobacco control that you mentioned, we have an FCTC. But for other things like SSB, we do not have, or ultra-processing food, we do not have. But we, like from the local, we provide the evidence, we provide the information, and then to advocate for higher level. And from international level, we support for local level. For example, for Vietnam, like I said before, for the report, the complementary report for the CRC, we provide the information about the situation, and then we put the recommendation to the UN committees, and then the UN committee to provide the recommendation for the government of Vietnam to take the action for that. And I think that we should do something like for the local, the country level, the sub-region level, like for example, in the case for the Asia country, or we can doing the regional level for Asia level, or Africa, or Latin American level, and also international level. And each level will contribute and complement each other for that. And then we can bring the children participant to a different level, from local, regional, and then international level. So we contribute each other for two topics, but I think that is interlinked each other.
Yeah. It strikes me that in tobacco, as in food, children are being targeted by very powerful industries, and so the likes of some sort of international framework around digital marketing and protecting children from unhealthy commodities, I think is critical. Unfortunately, we are past time. We want you to continue the conversation. Certainly here in the room and online, and most importantly, in your advocacy on these issues, to bring back this global momentum and conversation into local action. So please, a big round of applause for our panelists. And a big thank you again to UNICEF for co-hosting this event with us, and for all of you and your terrific questions and your participation. Thank you.